Hi, I'm Dr. Jeff Nickel, and I have the Nickel family border collie, Miss America, and I have Tony, and I have Gaston. He's over here. And, you know, I've been in general medicine for, well, frankly, over 40 years. But I gave it up a few years ago because my behavior practice was, you know, keeping me just busy enough. And I had completed my residency in behavior. And so these Facebook Lives are usually about behavior disorders. Well, this time it's not really behavior. I want to talk about foxtails. Let me show you what these darn things look like. Excuse me, Gaston. I have Gaston and Tony here. And let me see if you can see this darn thing right there. And it's not focusing. I've got some others I'll show you. These things show up. Here's what the individual grass awns look like. Can you see those? These things are pointed on the end. And if you look at the whole plant, it's a weed, and it looks like this. And these darn things are actually an oatgrass seed, if you will, that can find their way into any part of the body and cause an enormous damage to the pet's well-being because they cause immediate pain. These are things that have been known to very commonly get under the eyelids of dogs and cats. They, particularly a fuzzy breed like a border collie, all this fluffy hair around their ears, they get picked up. These darn things have a, there's a point on it. Let me bring this darn thing a little closer to the camera. There we go. Can you see that? Not very well, I guess. And then the feathers on it that come back look like a badminton birdie, or what's called a shuttlecock is what these things look like. And these little feathers on it have barbs. So when they find their way into an opening, and this can include the genitals, the penis and the vagina, we find them in there. They will make a hole, that little point in the end, will make a hole through the skin, and it can occur anywhere in the body, but very commonly between the foot pads on the top surface of the paw. You know, the skin is sort of, well, delicate there, just like ours. And these things cause immediate discomfort. These pets who get a foxtail in their ears will immediately start to scratch and rub their ears. If you touch the ear just like this, it's painful. Their eyes, if they have one under the eyelid, will discharge like crazy, and the tissues around the eye will become reddened and swollen. If they lick their genitals a great deal, you know, a sudden onset of intense discomfort like that, if you live in the United States, anywhere but the South Atlantic part of our continent or the Gulf Coast, those are the only areas that have been spared this nasty weed. Now, some areas have it much worse than others. Here in New Mexico, we have a lot of these darn things. California, I practiced there for a couple of years back in the mid-70s. We did a lot of foxtails. I mean, they end up in a lot of places. And our friends in surgery, and I did a lot of general surgery, and I've dealt with a lot of them surgically, but veterinary surgeons, the specialists, they'll sometimes find these things in spinal cords. They've been found in the brain. I had a case where one of them had found its way, after being swallowed, up into the bile duct. It was making its way toward the liver. I had a cat once with a chronic coughing problem, and we could see one lobe of lung that was inflamed and consolidated. It had a lot of fluid accumulation in it. And we ended up taking that lung out, and of course, we found a foxtail in it. A little bit of it had been inhaled by this cat and had lodged down in there. And because of the shape of this thing with these, like feathers, as I call them, with a whole rows and rows of barbs, little tiny ones, you can see under a microscope. If you have a magnifying lens, you can see them. It's almost impossible for these darn things to work their way out. So this is a serious problem, and it is certainly a pet welfare problem. And I want to make people aware of this because they can, well, they can get very sick from these things. There are cases where folks have, these things have been in the pet's ear. I don't know, maybe the pet had a history of ear infections, and I thought, well, here we go again, another ear infection. And once we get all that discharge out of there, we find a foxtail or two. So very often, because of the way these things bury themselves in the tissue, and especially when they go to the paw, they can actually begin working their way up the leg. And we get a lot of this chronic inflammatory thickened tissue around these foxtail awns. It's AWN, awn. It's a it means a cluster of grass. A seed that disperses is really the definition of a grass awn, is often what they're called. There's so much inflammatory tissue that very often we'll treat them with antibiotics for a week or two, get some of the infection controlled, and they get the swelling down. But in some cases, we have to go in and surgically remove the chronic inflammatory, what's called granulation tissue around this. And I have a couple of people. Cindy, well, excellent. Thank you for tuning in. If anybody has a question, by the way, it doesn't have to be about foxtails, but I want to make this thing an awareness thing, because if you have a pet who's suddenly got a problem, boy, you want to get this thing checked out. It's not uncommon, by the way. You know how dogs eat grass? Cats will do it too, but this is a problem with dogs in the throat. They have tonsils, just like we have, and the tonsils sit down in a little kind of a depression, what's called the tonsillar crypt. It's a little area where the tonsil lives. And if a tonsil's not inflamed, the dog or cat does not have tonsillitis. It sits down there, kind of minds its own business, doesn't cause any trouble. But there's a little space between the tonsil and the little wall of that tonsillar crypt. And they out there eating weeds for, try to settle their stomach, whatever. We can get a foxtail stuck in there. And the point of the darn thing will make a hole, and these dogs will start to choke and gag and cough. And if that starts to happen pretty suddenly, and it just doesn't stop after, like 30 minutes or something, that pet needs to see its veterinarian. Now, needless to say, a lot of these, if they're going to be removed early, we use a pair of forceps. In the veterinary clinic, we use forceps like this. If you find one just very close to the opening of the ear canal, or in the skin, and it's just starting in there, use a pair of tweezers that you might have in your medicine chest at home, and you can pluck them out. But many of these are so darn painful that we can't get them out of the pet unless we use pretty heavy sedation. Manhandling and rodeos and restraint, that's not okay. We've got much better ways nowadays, and very safe sedatives that will make it easy for us to take care of these things without the pet having more pain. So do the right thing and get your veterinarian to look at these darn things if you're at all concerned. I wanted to tell you a story. This is a German Shepherd that I knew very well years ago. I knew it well because it belonged to a very conscientious pet parent. It was the sort of person that, if she was concerned, she brought it in, and we took care of it. We look after those pets. Well, this dog started having trouble with its anal glands. Now, for anybody who doesn't understand anal glands, you're lucky. Fortunately, we humans didn't get cursed with that bit of anatomy, but dogs and cats have it. It is very much like, or it's an evolutionary vestige of the scent gland of a skunk. Of course, that species, they use them as a defensive mechanism, but cats and dogs have them too, and they produce this foul-smelling secretion. They sit right next to the anus on either side. There's a little opening right into the anal opening. And those things, usually the fluid drains out and they don't cause a problem. But in some cases, they become infected, and if they don't drain very well, then they can get backed up and infected. So it's occasionally seen in cats and occasionally in large breed dogs. It's largely a problem with smaller breed dogs, like miniature poodles, Papillons, Yorkies, Cocker Spaniels, some of those. Well, anyway, there are those darn little openings in about the 4 o'clock and the 8 o'clock position, right around the anus. And so this dog, Tortuga, which is Spanish for turtle, this big German Shepherd, it came in because it was scooting and licking its rear end. Well, veterinarians, we see a lot of anal gland problems, but it was a big breed dog, and I thought, it's not impossible that this dog could have an anal gland impaction or an infection. So, I checked the anal glands, put a glove on, palpated them. I didn't get a lot of discharge. I did our usual, where we infused a antibiotic and anti-inflammatory ointment into the anal glands so that we could kill off infection, make sure they were irrigated well, and it improved a little bit, but not the way it should. Well, it came back about a week later, and I'm looking at this dog thinking, what's wrong with this picture? And when we see situations that aren't, follow the usual, outside the norm, well, it's important for the doctor to say, okay, why not? It could be just a little unusual, but there might be another reason. So I went ahead and I sedated Tortuga, and those darn little openings, those anal glands are pretty small, but I went in there with a long-tipped, very fine forceps, and you can't see. You have to hunt blindly. And I just probed around there gently and pulled out a foxtail. It had found its way all the way down in there. So, back to the usual, MO of this darn thing. They cause a sudden problem, an intense problem. Dogs licking, scooting, rubbing pretty intensely, coughing, discharge from the eye, rubbing. Oh, look at this. I just brushed you before I brought you upstairs. Look at this. Right there next to her ear, and I promise you I didn't plant this. There's a foxtail right there that I found right near the base of Miss America's ear flap. And I tell you, for a pageant queen like this beautiful girl here, that's not consistent with, the tiara. So, and she is a perfect dog for this, and we live in what we call a semi-rural area north of Albuquerque. It's in the unincorporated area in the county. And so, we got a bigger piece of property. It's not a suburb. And, we've got part of it landscaped, and part of it is a lawn and all that. But part of it isn't. And so we've got these darn weeds. And in New Mexico and most anywhere in the West, but also in the north central part of the United States and the East Coast now, we've got these darn foxtails. So be aware of what they look like. And I posted a picture of one on my Facebook page today, photograph I took myself, and a couple of them actually. You can get a pretty good idea of what they look like. So be aware of these darn things. And we're really big on prevention. I have a brush here, and I'm a believer in grooming pets and pulling loose their dead skin flakes, and their coat feels better when it gets stimulated. Sort of like when you brush your own hair, it's like, it feels pretty good. Okay, same reason we have to break loose dead skin flakes and dead hair. But for a coat like Miss America's, we just brush her at least a couple of times a day. Actually, usually when I let her in, and here she is sitting on this chair with me. And here are two more of these darn things that fell off her coat. They're kind of everywhere. And so often when I'm brushing her, before letting her in the house, and she goes in and out all day long, as I'm brushing, I'm looking for them, and sometimes as I'm brushing, they sort of come to the surface. We have found them between her toes, and we're often checking, and sometimes she starts to lick, and there it is, and it's just starting to irritate the surface of the skin. It hasn't quite penetrated, so it's not hard to get rid of it, especially with a forceps. So these things they're a scourge. And what we find with veterinary internists and with surgeons is, they take referrals from general practitioners for difficult cases. That's where my behavior cases come from almost exclusively, is from general practitioners who may be somewhat adept at treating general behavior disorders, but they send me the tough cases because I'm a residency trained specialist. Well, our colleagues in internal medicine and in surgery, they get the tough cases. And what they find is that if they're finding symptoms and they've done their usual testing and evaluations, and they still can't quite find the darn problem, that's when they'll turn to ultrasounds and sometimes CT scans to find these things. And you don't see the foxtail on these images, but you can often find the thickened, dense areas of this chronic granulation tissue because the body has tried to wall it off because it can't get rid of it. And again, these things end up internally. And they'll go through the skin, and they've been found in all abdominal organs. They've been found in the spinal cord. So the neurologist might find symptoms of one-sided neurologic deficit, weakness, that kind of thing. Truly a neurologic problem. And on an MRI, they find there's something that looks like foreign material, and sometimes you have to do back surgery to get those darn things out. So, becoming aware of them early is really the way to go. There's a question here. I hope we don't have those in Texas. Cindy, they're all over the place in Texas. It's a desert area, and this darn weed does great in dry climates. I mean, it flourishes in dry climates. So yeah, they're in Texas, and you should be very, very watchful in your yard. And here again is what the darn thing looks like. Hope you can see that. And You can see some of this area, this little weed in my hand is dry. And so those little foxtail awns are just about ready to come off. And then the green ones, not quite ready. They're not ready to spread yet. Darn things are sort of everywhere. So, you know, it's really the takeaway from all this is that if you have a pet who's suddenly not feeling well, or even if it's been a problem for a long time, take it to your veterinarian and make your veterinarian aware that, you know, we may have foxtails. Because if the doctor isn't necessarily thinking about foxtails and you bring it up, then he or she might say, you know what, maybe I ought to consider that as a possibility and do what it takes to figure out what the cause is, and if it's a foxtail, deal with it ASAP. So that's what I have to say about foxtails. So it's a little shorter Facebook Live than usual, but I'm just delighted to be able to pass on this information. And if there are questions, or if you like what you're seeing, hit the wow button or the hearts or something like that. You're very welcome to ask me a question on my Facebook page. And sometimes those things are pretty helpful for a lot of people, so I put them in my weekly question and answer column in the Albuquerque Journal. And Brandon. So, what are foxtails? Well, I'll just run through it real quick again. It's these things, this weed. It's often called a foxtail barley. It's indigenous to the western United States. In other words, it's been here since, you know, before the Native American people got here, probably. But, you know, people move around the country. And so it isn't just in the western part of the country. When I was in veterinary school back in the early 70s, dates me a little, it was a western problem. It was largely California. But, you know, again, they're everywhere in the continental United States except the southern Atlantic area and the Gulf Coast area. Now, of course, some parts of the country it's worse than others, but they will invade the body. We see them a lot in dogs, but we see them in cats too. And Gaston, the little fuzzy white guy right here, his fuzzy hair makes him more of a potential victim of this thing. Short-haired cats like Tony and short-haired dogs, less prone. But, you know, this fuzzy, soft, fine hair, foxtail just lands on the coat, and with the pet's movement, it just gradually, the point of the thing works its way toward the skin, or in the case of the face, the eye, ears, probably the most common place that we find them. So there isn't any real home treatment for them unless you pick it up so early that it's just beginning to make a little opening in the skin, and you can pluck it out with a pair of tweezers, you know, like the kind that you might have in your medicine chest. So that's the story on foxtails. If anybody has a lesion in the skin, for example, and these darn things can get red and puffy, they don't always discharge. I mentioned a minute ago that because of the shape of these darn things, the body cannot eliminate them on their own. Many plant material, foreign material, the body can actually work it loose and it comes out, but the foxtail doesn't. So if you have a problem with your pet's skin, you're welcome to take a close-up picture with your smartphone and post it on my Facebook page, and I'll give you some thoughts on it. But if I'm not going to be able to examine it in the exam room, I'm going to send you to your veterinarian, because there's nothing like a up-close and personal physical exam. So, thank you so much for tuning in, and I hope these things have been helpful. And we'll be back next week, Thursday, the 30th, 6 o'clock Mountain Time, 8 o'clock Eastern. And I haven't decided what we're going to talk about then, but it'll be a strictly behavioral topic, because that's where some of the worst misinformation, you know, people try to get help on the internet or buy books, and there's a whole lot of stuff out there that's, you know, just ain't so. And so I'll clear those things up with research-based information. So we'll pick a good topic next time, and we'll, you know, share some information. Which, one last point, if anybody has any particular topics that they would like me to cover, please send it to me on my Facebook page. And also, you can get these Facebook Lives sent to your email, along with my weekly question-answer media that I put in the newspaper every week. You can get them on Tuesday mornings. Just go to my website, drjeffnicol.com, drjeff, Nichol.com, And you can subscribe. It's no charge, of course. And when you do, I'll send you my free at-home pet first aid and CPR guide, which can be a lifesaver as well. So, are they only dangerous after they've dried? Actually, Jenny, that's about right. When they're green like this, like those at the top, that's still a living plant and they stay on it. If you look carefully, you'll see that the green awns at the top of this, below it is a green stalk. Right next to it, attached to the same darn plant, is a dried one, which that's when they release those darn amber beige colored awns. So yeah, to your question, they are a problem after they're dried. When they're still green, they're not going to be dispersed. They're going to stay on the plant. So we don't very often find the green ones on pets. Let's see, anything else? It looks familiar. Yeah, hunt around your yard. And you know, you can dig them up, you can burn them out, you can do all that stuff, but you won't get rid of them unless you totally landscape your yard. Or if you take your dog outside your yard, places like dog parks, hiking trails, you don't have to be super vigilant, but when your dog comes in the house or arrives home from one of those outings, that's when you check carefully. Okay? Well, thank you again. I'm Dr. Jeff Nickel, along with Miss America and Tony and Gaston.